Well, hey everybody, it's Sandy and welcome back to my channel dedicated to helping you advocate for your own health one topic at a time. So today I want to talk about that new statement by the CDC in which they said that the mode of transmission being from contaminated surfaces is not quite as likely as they thought before. Okay, it's less of a threat than they thought. And I had a couple people say that to me in comments, and then somebody else asked me, that contacted me and said, what are my thoughts on that? So I'm going to give you my thoughts, and then I'd actually really like to hear yours as well. This is such an evolving situation. So the long and the short of it is, I fail to see what's changed, really. As far as we knew before and as far as we know now, there are three modes of transmission for the COVID-19 virus. The primary one, by far and large, leaps and bounds beyond the rest, is the large respiratory droplets. Okay, when we talk or even sometimes when we breathe, we don't have to be coughing or sneezing. We emit large respiratory droplets that sometimes land on other people's mucous membranes, the eyes, the nose, the mouth, or people can inhale them. And that is the primary mode of transmission for this virus. Second, after that is by contact with a contaminated surface where maybe you're to touch a surface with active virus on it, maybe somebody sneezed or somebody, some large respiratory droplets fell onto that surface and you were to get that onto your hands and maybe inadvertently touch your face. That's a secondary mode of transmission. The third one is the inhalation of really tiny, small aerosolized particles of virus. That's almost a non-issue for people who are not working in environments where they are making aerosolized form of virus. So like in an ICU setting on a COVID floor and things like that. And in those cases, people are wearing N95 respirators plus face shields because even the respirator doesn't always filter down small enough. So the two primary modes being the large respiratory droplet versus the touching of contaminated surfaces still exist in that order. It would be one thing if the CDC had told us this is really not a threat like we once thought, or this is very highly unlikely, but they're not saying that. And as a matter of fact, as we reopen the country, the CDC guidelines are still to maintain the same measures that we were doing before. So one being social distancing, another one being frequent hand washing. Obviously, that has to do with contaminated surfaces. And another one is frequently disinfecting surfaces. So I think this was nice in that perhaps if I were to realize that I just touched my face and I should have washed my hands, which we're all human and those things happen, maybe I won't be quite so worried about it, but it doesn't really change anything to my mind. So I'd be really interested in hearing what you guys think about that. Now, if anything, it does, in my opinion, change or tell us, it's very enlightening about what maybe we should have done a couple of months ago. Because a couple of months ago, we were saying, wash your hands, wash your hands, wash your hands. And I think if we were going to pick just one thing, then we probably should have been saying, wear a mask, wear a mask, wear a mask. Which only really works if most people are doing it. I think upwards of 80% of the population has to do it because the mask mostly protects other people. So as an aside, I did review in my last video a mask that is designed to protect the wearer, not only the people around the wearer. That was the Sonomask. I'm still enjoying it very much, and I'm hoping to review another mask which also claims to offer some protection for the wearer. I'm hoping to do that maybe next week. For those of you who saw my video on that Sonomask or didn't, I'm going to link it down below. But I do want to draw your attention to the fact that I did put in the description box some editing. I added a correction. There was something I misspoke about. The long and the short of it is I don't think it's of any consequence to my review, and I explained all that, but I just hate to leave something hanging out there where I gave any information that wasn't accurate. So yeah, let me know what you think about this whole thing. I just don't see it. I don't see it changing a thing that I do. But I'd really be interested in hearing what you're doing and what your thoughts are. If you haven't subscribed, please do so. I've always loved your feedback and suggestions for future content that you want to see. And until next time, be well.